The U.S. could be on the verge of a potential game changer in the country's coronavirus fight. Pfizer has officially submitted its COVID antiviral pill to the FDA for emergency authorization. The company says its pill is 89% effective at reducing the risk of hospitalization or death in high-risk patients if given within 3 days of symptoms. If authorized or approved, it can be prescribed at the first sign of infection or first awareness of an exposure. This all comes 1 year after a critical care nurse in New York received the first U.S.-approved COVID-19 vaccine. More than 202 million Americans are now fully vaccinated against COVID, but 23% of the eligible U.S. population have yet to receive at least one dose. With more on Pfizer and COVID-19, let's bring in Dr. Payal Patel. She's joining us now to discuss. So, Dr. Patel, in Pfizer's latest study, the drug company revealed that less than 1% of patients who received their antiviral pill were hospitalized. Now, that's compared to 6.5% of patients who received the placebo or were hospitalized or died. What do these numbers signify to you?
Yeah, I think that's actually really good results. We had seen some preliminary results from Pfizer about a month ago, and this is really going to strengthen the case that they're putting forward to get this drug approved. Why is this important? Right now, if you were to come in, really the monoclonal antibodies that we have that we've been treating patients in the ER, they're pretty complicated to give. They often need to be given either subcutaneously or, it involves a lot of healthcare facility use, which is why it's difficult in a hospital that has ERs full or inpatient full. This is going to be a pill. So that could really change how we're treating patients that are coming to the ER.
So, as you know, earlier today, Pfizer's CEO joined CBS Mornings to discuss this antiviral pill. I want to play a bit of that conversation and come back to you about it.
What makes you think that the pill will exist parallel to the vaccine as opposed to as a replacement for the vaccine? There's a lot of Americans, maybe 40%, who don't want that vaccine. Is this going to encourage them to be like, yeah, you know what, we don't need it. I'll just take the pill?
There is a risk to happen of what you said, and that will be a very big mistake. Vaccines are needed. People need to prevent getting sick. They should not take chances that they may not get seriously sick because there is a pill that could treat them. People should prevent. And not also should prevent the disease from them, should prevent the disease from the people that they love. If they get it, they are the ones that will give it to their parents, their grandparents, the kids. So people need to do the vaccinations. But unfortunately, there will be cases of COVID disease. And now this is the big news, that when we have COVID surges, usually what is happening is that our hospitals are overwhelmed. People are in ICUs. Hospitals need to change their normal procedures. Sometimes they postpone elective surgeries. It's a very big problem for the healthcare system. Right now, with this pill, instead of 10 going there, only 9 will stay at home, and hopefully nobody will die. This is a very big deal.
So that was my concern when I heard the news about this antiviral pill, doctor, which is that, as Tony pointed out, that some people are going to say, well, I don't need to get vaccinated. I'll just take the pill, which also is sort of strange to me. If some of the criticisms from folks who refuse to get vaccinated, and not talking about those who have medical reasons or religious reasons, but for those folks who say, I don't want to be mandated to do something, put something in my body that I don't want to put, I don't understand what the difference between a pill and a vaccine would be, because the vaccine and the pill both have a reaction when you take them. I guess. I'm not a doctor. You tell me if I'm wrong.
Totally agree with you. And I would think of this as, just another piece of the fight against COVID, with that biggest and most effective piece still being vaccines. And, for the folks that are still concerned about what's in vaccines, we're looking at hundreds of millions of people 1 year later that are doing fine, right? That got the vaccine are doing fine. These new pills have just been produced. And so out of the two, I would say the thing that's the most trustworthy, most effective, continues to be the biggest part of the fight against COVID is vaccines. And we're just thinking about this as another piece of the puzzle.
So there's this new study from South Africa's largest private health insurers that says the Omicron variant is substantially more contagious and reduces the effectiveness of COVID-19 vaccines. The researchers suggest that the 2 shots of the Pfizer vaccine is only 33% protective against Omicron, but 70% protective against hospitalization. So what should people know when they consider coming across information in headlines such as this? I mean, this is, even I saw this and I was like, wow, I know we've been, for the last 18 months, we've been talking about ways to protect ourselves from COVID-19. We all remember when the nurse in New York City received the first vaccine. I remember how everybody was so happy. People were posting photos of themselves on Instagram. I got the shot. I'm so thankful. Thank you, science. Thank you, doctors. And now you see information like this and it makes you go, what's going on here?
I'm glad you pointed this out. And, that optimism that we had 1 year ago, I think that there is still a reason for that optimism. So many of us that have gotten vaccinated have done just fine, right? And so that is, again, evidence that the vaccines work. I think the statistic that needs to be bolded in this most recent study is that we saw that the vaccine was about 90% effective and may go down to 70% effective against preventing hospitalization. Again, at the end of the day, that's what we all want, right? Is to avoid going to the hospital, avoid having to go to the ICU, losing more family members. And that's what's really important. The first number is really just considered infection, and that could be a mild infection. That could be an asymptomatic infection. That's going to be in a totally different category. So at the end of the day, vaccines are still working, and that is good news.
Speaking of the Omicron variant, Doctor, I saw a headline in the New York Times that said Omicron is the dress rehearsal for the next pandemic. And essentially what it described is a world where some virus or some disease comes out of nowhere, and we need to do all the things that we have been conditioned to do when it comes to COVID, in other words, tracking and testing and developing vaccines. But are we prepared? I mean, with Omicron, it felt like we were sort of still behind the 8 ball. I mean, we were implementing travel bans when the virus was most likely already, the variant was most likely already here in the United States. Are you worried about the next real pandemic not related to COVID?
Anything that brings a spotlight to infectious disease research and public health research, we know at the end of the day, that's been what's got us through. I don't want to imagine a year like the last where we didn't have vaccines that ended up being developed so quickly with the help of federal government, scientists working all over the world, really worked together to get us where we are. We're not where we want to be. And right now in the United States, we're struggling so much, even with the Delta variant. It's worrisome to add a new chapter to that with this new variant that we're talking about. But I think that the biggest factor at this moment is also some pandemic fatigue. Thinking about 1 year ago, masking, having masks in your car, trying to avoid those social gatherings. We were in a totally different mindset as a nation. And sometimes it's hard for folks outside of the hospital to see what we're seeing here. And so I think that's a lot of what's going on 1 year later. But the best thing that you can do this holiday season and going into the next year is, again, reminding yourself, your family, it's really important to get vaccinated, get boosted. And that's going to be the best way to kind of protect ourselves going into the new year.
Good advice as always. Dr. Payal Patel, thank you as always. Appreciate it.
Thank you.